Now that brings me to what I came here to discuss today, some Obamacare provisions that should be keeping my colleagues and all Americans up at night. Obviously, my views are somewhat different, or very different, from my colleagues who have just propounded their views here on the same subject. Unfortunately, since the implementation of Obamacare began, the stories and reports have only confirmed the many warnings that I and many of my colleagues made during the debate. Most of the stories, Kansans tell me now, involve many hundreds of dollars in increases in monthly premiums or people simply losing their coverage. Now, these are real stories from real Kansans, and they are not lies. Compounding the problem, this administration has made it a routine practice to do what we call a regulation dump on Friday. This is a deliberate posting, sometimes thousands of pages of regulations during the time when the American public and the press is least likely to be paying attention. Most recent reports from the Centers for Medicare and Medicaid Services, what we call CMS, are that millions of small businesses will face increased premium rates under Obamacare. Now, the President promised to make it easier for small businesses to offer coverage, and lo and behold, it may have become impossible for them to do so. And then there are the cuts our seniors are about to face to Medicare plans. We can't forget that the President pilfered, that's a good word, pilfered $1 trillion from Medicare to pay for Obamacare. These cuts have been delayed, but the most recent regulation on Part D and Medicare Advantage will be extremely detrimental to seniors' access to the availability of Medicare plans. And because of this, for once, I'd like to talk about a subject where we get ahead of the curve, get in front of the next disaster and repeal specific provisions of this law that I think will be most harmful to patients. I've talked about how this law comes between patients and doctors before, but I think we need to bring more attention to the specter of what I call rationing. Yes, rationing. In the absence of complete repeal, I want to urge my colleagues that these provisions must be repealed. During the health care reform debate, many times since then, I spoke at length about rationing. Specifically, I want people to know about what I refer to as the 4 rationers that are included in Obamacare. And yes, this is a very real threat, and yes, they will ration care. Let me start with something called the Centers for Medicare and Medicaid Services Innovation Center. Now, that's a pretty big, fancy government name. And the center has an enormous budget to match, aimed at funding innovative ways to reform payment and the delivery of health care. Now, that sounds very good, but what this really means is that the Innovation Center can now use taxpayer dollars to invest in ways to reduce patient access to care. Let me say that again. The government can now use taxpayer dollars to invest in ways to reduce patient access to care. It gives the government new powers to cut payments to Medicare beneficiaries with a goal to reduce program expenditures. But the reality is they're going to reduce patients' ability to access the care they want and need, all hidden under the cloak of innovation. And that isn't innovation at all. Even if they did give it a fancy title, folks, it's smoke and mirrors. Now, this outfit is already pushing out all of the regulations to implement Obamacare that are now hurting patients, all the regs that we hear about from our health care providers. Let me move to the second rationer. It grants new authorities to the U.S. Preventive Services Task Force. That's another nice-sounding entity and a long title. This Preventive Services Task Force used to be a body that was scientific and academic, that reviewed treatment, testing, and prevention information and made recommendations for primary doctors. Nothing is wrong with that. That used to be an academic body that made recommendations. not a body pushing through mandates and regulations. Many would argue that that is still what they do today. However, the effect of their recommendations is they are significantly more costly and burdensome. Because of Obamacare, the task force can now decide what should, and more importantly, should not be covered by health plans. That's not prevention, that's rationing. If the task force doesn't recommend it, then it won't be covered by your health plan and you will bear the cost of the procedure. And already, we are seeing this with things like prostate exams and mammograms for breast cancer, which have been so helpful to so many people, saved their lives. The third rationer is the Patient-Centered Outcomes Research Institute. Yep, that's another mouthful. But this is the outfit that was given millions and millions of dollars to do comparative effectiveness research. Now, I'm not opposed to research. I don't know anybody in this body who's opposed to research, especially when it's used to inform the conversation between doctors and their patients. But there's a reason this was formerly called the cost-effectiveness research. There is a very fine line between providing information to doctors and patients to determine the best course of care and using that information to decide whether the care or treatment is worth paying for. I have long been concerned that instead this research will be abused to arbitrarily deny patients access to potentially life-saving treatments or services. And that just simply should not happen. The research should only be used for the doctor and the patient to make the best healthcare decision. And finally, the fourth rationer, my personal nemesis, the Independent Payment Advisory Board, IPAB. This is a board made up of 15 unelected bureaucrats who will decide what gets to stay and what gets to go in Medicare coverage. They'll decide what treatments and services will be covered and which will not. No accountability whatsoever. When proposed supporters of the health care law told me we are too close to our constituents, it's too difficult to make the hard decisions, then they said, let's have somebody else do it. That was during the debate with regards to IPAB. I couldn't believe it. I believe we are elected to make the hard decisions and take care of the hard votes. And I believe that is the way Kansas wants it, and I think that is the way virtually everybody in every other state wants it. This board diminishes our constitutional responsibility. Even worse is the fine print of the Independent Payment Advisory Board, or IPAB. If Kansans or any Americans determine that they do not like the direction that the board is taking, they call my office and down the road any other office of any other distinguished senator, ask me to do something about it, which is what you get when you go back home on any regulation today. What are you going to do about it? It will take 60 votes in the Senate to overturn their decision, 60. Now, on the surface, this sounds okay until you realize that the president doubtlessly will never support Congress overturning the recommendation of this board made up of his bureaucrats. So he'll veto it. And overriding a veto obviously takes 2/3 of a vote. That's 66 votes to overturn a decision by the payment board. My colleagues have been changing the rules around here because they think 60 votes is too high a threshold. What are the chances of reaching 66? But wait, there's even more. If the Secretary appoints a board unable to make recommendation for cuts to Medicare, tough decisions, albeit, then she gets the authority to make the decision of what to cut. One person. Now, this president has already cut $500 billion from Medicare to pay for Obamacare and gave himself the ability to go after even more Medicare dollars and have no accountability. This, my friends, is frightening. It's ridiculous. It's irresponsible. But it is not new. I've been talking about the four rationers for a long time, what it means to patients, especially senior patients. What really upsets me, scares me, as I watch all the other warnings and broken promises come true, is what's going to happen to Kansans and all the folks back home when the warnings about the four rationers come true. We need to protect the all-important doctor-patient relationship which the four rationers put at risk. That is why today I come to the floor to introduce the Four Rationers Repeal Act of 2014. For once, look beyond the current troubles that we are experiencing. We've got to get ahead of the curve. This legislation repeals the End of Payment Advisory Board. It repeals, euphemistically, but misleadingly named Innovation Center. It repeals the changes made to the Preventive Services Task Force, and it makes sure any comparative effectiveness research, called CER, is used by the doctor and patient, not coverage providers or CMS, to determine the best care for patients. This legislation is relatively simple, should be supported by all of my colleagues to address some of the egregious changes from Obamacare that are about to happen just around the bend. Time to get ahead of the curve this time, prevent it. I really believe that in order to protect this all-important doctor-patient relationship, we need to repeal and, most importantly, to replace Obamacare with the real reforms that work for Kansans and all Americans. However, in the meantime, we can also start taking it down piece by piece, which is what my Four Rationers Repeal Act does. I urge my colleagues to support this proposal, and for once, let's get ahead of the curve. I yield back the balance of my time.
The senator from Ohio.
Thank you, Mr. President.